Well, thank you all for being here, and I wish to thank the organizers for inviting me. And as soon as Rez will give me the first slide, I will begin. And I will begin with the words of the philosopher who say that if something could be expressed with words, 3 words are enough. Now, the Ministry of Health of the Italian Republic is not a philosopher, and it takes 8. And it is no cause and effect relationship between HIV and AIDS. So having said this, I could leave, and thank you, but if you give me a few more minutes, I will try to explain you why this choice, because here I shall present data from the Italian Ministry of Health that support the hypothesis that HIV is not the cause of AIDS. And there is a reason for this choice, instead of presenting scientific data that we have, to present bureaucratic data, and this reason derives from logic. Because here we have 2 formal systems, a scientific theory, the one that says that HIV is the cause of AIDS, and then laws and policies that are superimposed on this scientific theory. So the axiom is that 25, 26 years after the onset of the epidemic, the 2 systems must be isomorphic, as Wittgenstein would say. That is, the laws and the policies must be based on solid scientific evidence. Otherwise, the problems for public health would be much worse than a scientific dispute. So if we want to verify the theory that HIV causes AIDS or not, we simply can study the laws and the policies that are based on that theory. And let's start with the obvious. Where is written that HIV causes AIDS? This reminds us of Kary Mullis, who couldn't find scientific evidence for HIV causing AIDS. Well, I just looked at the updated, just a few days ago, webpage of the Ministry of Health that is entitled Conoscere, that means to know, HIV and AIDS. This is the page in Italian. I can translate it for you, but it is not important. Well, nowhere you will find in this page that is directed to lay people who is not supposed to know anything about HIV and AIDS, that there is a cause and effect relationship between the 2 things. AIDS is described, the virus is described, but there is not even mention of an association between the 2 things, not to mention cause and effect. Well, you may think that at the ministry they don't know the concept of cause and effect, and maybe that's the reason why they don't use it. But this is not true. They know the concept of cause and effect, and they even use it when it is highly debatable. There is a law in Italy that states that on cigarette packs those words must be written with these huge characters, and it also specifies the font, and it says smoking causes deadly lung cancer. And this is, from the oncologist's point of view, is somehow even debatable, but this just to demonstrate this is the law that dictates the words, that the ministry knows the concept of cause and effect. And now, the ministry is consistent because since it does not explicitly say that HIV is the cause of AIDS, then it gives you the possibility to have HIV-free AIDS. That is, in the normativa, which means laws, it is clearly written that AIDS could be diagnosed in the absence of signs of HIV infection. And this, of course, reminds us of something, because it was 2003 when Professor Duisberg, in his paper, simply stated that if HIV-free AIDS cases exist, and they do exist, then HIV cannot be the cause, at least of those cases of AIDS, because it is not there. And the law, the Italian law, just accepted this concept, and this is the official bulletin. This is law. I mean, we must obey to this law that says AIDS can be diagnosed in the absence of positive results of HIV infection if one of the diseases used to define AIDS is definitely diagnosed. So if you have a chronic herpes simplex mucosal infection, and here chronic stands for 31 days, and you are HIV-free, still you are an AIDS patient with all the consequences that you can imagine. So here we have AIDS without virus, officially recognized. And in the next slide, there is the official test of the law. Again, I could translate it for you, but it's useless. Please trust my words. And there are other, but you can read them once they will be on the website. And these are other notable inconsistencies. Well, they are inconsistencies if you believe that HIV was the cause of AIDS, but apparently the Ministry of Health doesn't seem to believe this, because all these are not inconsistencies if you think the other way around. Well, there could be several causes of immunodeficiency: high dosage steroid therapy, Hawking disease, multiple myeloma, lymphocytic leukemia. All these and hundreds of other causes of immunodeficiency are not AIDS if there is no HIV. And this is quite logical. So there is no HIV, and the cause of immunodeficiency is due to known factors that depress the immune system. But if you have diabetes, sarcoidosis, or pregnancy that are classified by the law as known causes of immunodeficiency, and you have no HIV, still you are an AIDS patient. This clearly makes no sense, because this AIDS or this immunodeficiency is due clearly, by definition, to diabetes, sarcoidosis, and pregnancy. There is no HIV, but still the diagnosis of AIDS could be made. Again, this is inconsistent with the scientific theory, but is perfectly consistent with the notion that AIDS is not due to a virus, and this, we should thank the ministry for this. Now, is AIDS a relevant disease in Italy? Not at all, according to the ministry, because we have a method of classifying infectious diseases. There are different classes in order of importance, in order of relevance for threat to public health. The first class is defined as diseases for which immediate notification is required, either because under international health rule or because they are of particular interest. And in this class there are 13 diseases, including cholera, botulism, influenza, and rabies. Then there is a second class. The second class of infectious diseases is defined as diseases that are relevant because at high frequency and or susceptible of control intervention, 25 diseases including mumps, evidently all more relevant than AIDS, because AIDS is not in those two classes. It is in a third class, less important, and thus it is obvious, is not of particular interest for the Italian Ministry of Health. It is not relevant, not at high frequency, nor susceptible of controlled intervention, and we may all agree about this. And why is AIDS so scarcely relevant in Italy? Well, let's go at the house of numbers. Are there numbers about AIDS and HIV? Well, about HIV infections, not at all, just estimates, simply because a national registry of HIV infection does not exist, has never been implemented. Millions of euros or billions of liras before were spent, but has never been implemented. It is estimated that there are new HIV infections, 6 new HIV infections for 100,000 residents per year. But let's look at something that we can measure: AIDS-related deaths. Many people die in Italy, including my ancestors, about as young as normal. We are a population of 60 million people, and about 600,000 people die every year. And since the beginning of the epidemic, 39,000 people died of AIDS-related deaths in 26 years. But let's go to my beautiful region, Tuscany, where Dante used to live. In Tuscany, we have a good control of statistics and a good epidemiological unit, and so you can read that in Tuscany there have been 7 deaths in 2005 and 4 deaths in 2006. And Tuscany has a population of more than 3 million people. So you can clearly see that it is not a relevant problem at all. And also, there is no pediatric AIDS in Italy. And also this is consistent with the prediction of Professor Duisberg of 2003. And only 1.1% of AIDS cases is pediatric. But pediatric cases are curious because from the beginning of the epidemic, about 1/4 or 1/3 of pediatric cases could not be attributed to vertical mother-son transmission. In other words, the mother was HIV negative. And so where did the baby get the virus? Not from blood transfusion or hemophilia, because that has been checked. And so it remains a mystery, unless you believe that the mother maybe was a drug abuser or took some types of drugs during pregnancy. And also, there is no spread of AIDS in the general population in Italy, and this too is consistent with the prediction of Professor Duisberg of 2003, because the incidence is 1 out of 100,000 in general population, 5-fold higher still in male homosexuals, and most important, 100-fold higher in intravenous, mainly heroin, drug abusers. So still the disease, the syndrome, is confined to those risk groups that were typical of AIDS 25, 26 years ago. And these are the data that demonstrate this lack of spread in general population. There is no nosocomial AIDS in Italy. There is a beautiful study that estimated that almost 100% of healthcare workers who were exposed to HIV will not be infected. And the seroconversion rate is statistic 0, between 0 and 0.4%, which is a statistic 0. And this too, again, is consistent with the predictions of Professor Duisberg. We're all consistent until the end. At the end, we shall have something completely different from Professor Duisberg's ideas. So, policies about HIV tests in Italy. Okay, this is in Italian, and this is a translation. It can be performed, well, I give you the original document. Well, here there are the original web pages of the ministry, just to demonstrate in front of a court that I'm not cheating, I'm not just inventing anything. So this is the law. The test can be performed only with the explicit consent of the interested person, informed consent. That means that the person has to be given information about the test and all the possible consequences. And also when you are hospitalized, also if you are in a coma, you have to give, or somebody for you has to give the explicit consent. So there is no HIV mandatory screening procedure. By law, there cannot be. The subject who undergoes HIV has the right to remain anonymous, and the information has to be given only to the person, not to the doctor, not to the medical system, not to any health authority. So only the person has the information. No one else has the right to know this information. No doctor, no insurance companies, nobody at all. And this also if you are in prison. And so this is a good thing if you happen to be in prison for whatever reason. Only in prison the test can be performed only with the explicit consent of the person. Of course, the employer cannot ask for the test for any reason. And also if you are in the military, the test cannot be performed without your consent. There is no mandatory test by law. And also, there is no need for medical prescription to perform the HIV test in public health laboratories. All this together let you know that the number of HIV-infected people in Italy cannot be known, because these laws, they prohibit the knowledge of the numbers. So we don't know how many people are infected in Italy. We know how many people die of AIDS, very little fortunately, but we don't know how many people are infected. And maybe because of this, there is no epidemic of HIV testing in Italy, and this says AIDS, a decrease of tests of HIV tests in Italy. This was a medical publication, Italian medical publication. And this is clearly stated in the webpage of the ministry, where it says that about 60% of newly diagnosed AIDS cases, they discover to be HIV positive only at the moment of the diagnosis of AIDS. In other words, the person, the subject, already has some condition that is suggestive of immunosuppression. And most often this condition is an infectious disease, and most often in Italy this is tuberculosis. At that point, only at that point, the HIV test is performed and it results to be positive. Now, we all know the complex relationship between tuberculosis and the immune system, tuberculosis and HIV, tuberculosis and HIV testing, up to the point that some researchers last year, they published in Medical Hypothesis, this has not been censored like our paper and Peter Duisberg's paper, this is still there, that the cause of AIDS could be the Mycobacterium tuberculosis, but I won't go into detail. But of course, if you are already immunodepressed for whatever reason, it's very easy that you could get chronically infected with HIV, as Professor Montagnier just said yesterday in the movie. Of course, since all these people didn't know to be HIV positive, they didn't take antiretroviral drugs, quite obviously. So 62% of AIDS cases, the pie on the left, the red one, 62.5% of AIDS cases did not receive any treatment before the diagnosis of AIDS. And still, mortality is decreasing, close to the statistic 0. 200 deaths, AIDS-related deaths in the last few years, which is close to statistic 0. And so, of course, this decrease in mortality cannot be due to antiretroviral treatment simply because these people didn't take the antiretroviral treatment. Dr. Mandrioli, after me, will elaborate on this point in detail. What do doctors think about antiretrovirals in Italy? Well, this is just anecdotal, and this was published because our Polish colleague couldn't believe that an Italian female surgeon was exposed to HIV during a nosocomial accident, and she refused, she declined the post-exposure prophylaxis with antiretroviral. But this is a general sentiment, is not open in the public, but they felt so compelled to publish this in a scientific journal that the Italian surgeon didn't want the antiretrovirals. So maybe this is more diffuse than we can think. And now let's go to the fundamental question. Why does the ministry appear to be so lukewarm toward HIV testing and toward HIV in general? Well, Google Map could help us. On the left, you see the Vatican. On the right, marked with an A, you see the Ministry of Health. It's about 2 kilometers, 1.5 miles. They're very close together geographically. And so here we have two hypotheses. The first one, by downplaying the role of HIV, it allows to put little emphasis on condoms. And please remember, let's go back to the webpage Conoscere, to know HIV and AIDS. To a lay public who knows nothing about these things, there is no recommendation at all about the use of condoms. It simply says, as a second cause of transmission, that it could be transmitted, the virus, through unprotected sexual intercourses, but nowhere the use of condom is recommended. And this certainly will not displease the Holy See, that just recently at the World Health Organization stated that it has in no way changed its moral position, which is fully coherent with the declaration that AIDS is a pathology of the spirit. And this is the speech of a cardinal. But also, this is a transcript. It's very ugly because it's the original transcript of the words of the Pope on the plane flying to Africa just a few months ago. A French journalist asked him about policies of the Vatican, about condoms in Africa, and the Pope answered with those words that distribution of condoms will only increase the problem of AIDS in Africa. So we know the position of the Vatican. They are coherent, they are consistent. And this could be the first hypothesis. Now you know the Cold War is over and the Patriarch of Moscow is supportive of the Pope's word, and we are happy that the Cold War is over. But now we have also another hypothesis that is as valid as the first one. In Italy we are very open-minded, and it could be that the ministry prefers to maintain a neutral position between the orthodox science and the so-called non-conventional views. And this is not surprising, and this is not unprecedented. For example, in my region, in Tuscany, since 1996, the Public Health Service sustains and encourages non-conventional medicine, including homeopathy, claiming that about 70% of patients reported the benefit, and this is paid for by the state in public health ambulatories. And this is the webpage of the health service, of the Public Health Service of Tuscany, stating this. And also this is interesting for us who work in a department of experimental pathology and oncology, very long established, because in Italy there is an anti-cancer therapy which is called unconventional cancer treatment, the Bella multitherapy, that never received any scientific validation at all. Never. Several trials have been tried, but they failed. And nevertheless, it is still widely prescribed and it is paid for by the public health system. And this is where it says in Italian that the public health system pays for this therapy, cancer therapy, that never received any scientific validation. Now, we're close to the end. Quite often, we are called dissidents or denialists, and it is said that we like to criticize, but we do not propose anything. Well, I prefer the word deconstruction that comes from Derrida. And deconstruction is the way to bring to the light contradictions hidden in common sense opinions. Now, if we read, according to this method, the information from the Ministry of Health is quite clear. HIV is not the cause of AIDS. It's written. Probably, as Derrida implies, this runs counter to the intended sense, but nevertheless, that's exactly what we can read. And then what it is true, if a truth in science has to exist, what we are able to read, or what we may suspect that maybe somebody else wanted to say but was unable to express, because we read those words. I prefer to trust what I can read. But after deconstruction, let's try to build something. If you want to come to Florence, it's a beautiful city to visit, in about 3 weeks, we shall have a meeting at the Military Academy of Health, so a very institutional place, where we shall present the final heresy. Because Peter Duisberg used to say that HIV is a harmless passenger virus. Well, we go beyond that, and we say, we entitled this presentation, this work that we shall present over there, The Killer's Promises. We say that HIV might even have established a symbiotic relationship in humans, because HIV has been in humans for more than 100 years, and this is said by the orthodox, by the mainstream science. This has been published in 2009 in Current Opinion in HIV and AIDS, and it has established a delicate survival balance. I don't want to be too molecular because it's boring, also it's my work, but the point is that one accessory protein of HIV kills rapidly dividing cells, and in particular cancer cells, by downregulating the expression of a gene which is called BCL2, that is an anti-apoptotic gene. In other words, it's a gene that prevents cancer cells to die, and the HIV protein kills the cancer cells. And we shall elaborate on that. I won't bother you with this presentation. This is another presentation for another meeting. But this could be the ultimate heresy. Not only an harmless passenger virus, but a symbiotic virus that established a balance with humans, and it even provides some benefit by controlling the growth of cancer cells. I'm close to the end, and I wish to thank you all, of course, and I also wish to acknowledge the help of my colleagues. Stefania Pacini and Matteo Galletti are here today. The other colleagues have been left in Italy. And Professor Duisberg and Professor Bauer for their constructive and helpful discussion. And of course, I thank the University of Florence and the Ministry of Health because they are funding our research. Again, we are in a free country, as in Colombia, and the university is sponsoring this research. We have met no obstacles at all. The obstacles came from the British publishers, not from the Italian authorities. And so I wish to thank you all and all the sponsors. Thank you very much.